Good afternoon. Today I'm joined by Mayor Tom McNamara and Lisa Brown from the Rockford Mass Transit District to give you an update on everything that's going on there as they begin to restore their services. So once again, I'm going to give a reminder, we are in the weeks approaching school, and we're going to call it back to school or mask to school. We are working to get our schools ready and prepared, and I keep reminding folks, because as we get closer, we are almost only 2 weeks away from many of the school start dates in our region, and it becomes important that we prepare ourselves as a community, as parents, to begin to bring our children back into the school setting. And again, like the healthcare systems and the rest of us, schools are going to learn to coexist with COVID. Both public and private schools in Winnebago and Boone counties have been working to make the necessary adjustments. They are working to reduce the risk of transmission in the school settings to staff, students, and their faculty. But once again, we're going to talk about being intentional. They want to be able to support both remote and in-person classroom, recognizing that as we talked about this in the past, there'll be rolls, there'll be waves, but we want to make sure there are trickles. Guidance will include universal face coverings. We've talked a lot about that, but we continue to help as parents begin this process to prepare their child to wear the face coverings while in school. Social and physical distancing, cohorting in classrooms in the elementary grades, reducing class periods and during the day to decrease the number of contacts. You'll hear today about mass transit and bus transportation, but the same concepts are going on in school transportation. Lunch times, as we know them, will be very different for those grab-and-go periods. How do we educate children with special needs and make sure that they are integrated in the classroom learning environment? Health checks is the norm, and increasing sanitation. But I'm going to emphasize again, while the schools are doing their work behind the scenes, the teachers, the custodial, the maintenance crews, the superintendents, all of them are doing their part, but we need our families to do their part to help keep the risk of infection low and to reduce the number of exposures. So as you begin this process, think about those outside school activities, including parties and sleepovers and tournaments, the clubs your children participate in, organized sports, religious education. Schedule your appointments now for needed school physicals and vaccinations. We want you to be ready to return to school. And we want you to practice masking with your children if they haven't been doing it over the summer so that they are ready. But again, the idea is to be intentional. The schools are planning intentionally to have you return, and families must plan the same to be intentional to return their children to school. I've had a lot of questions as we end through the summer months and as we continue through this beautiful weather of travel guidelines. I've asked, can we enforce travel guidelines? This is something incumbent on everyone in our community to understand that these are out there to help employers, to help community residents understand how we can continue to keep our disease transmission low. We ask that you review the guidelines and understand that the intent is to decrease disease transmission. It is not a ban or a travel restriction, but it's understanding what in areas we might have to be careful about as we travel or we have visitors from. We encourage the employers to adopt policies to support best practices, to understand the need to provide for remote work capability if you have to quarantine someone or you feel that it's the best practice so that they do not come into your workplace or environment to protect your other workers. How can you help them, support them to be able to work remotely? How do you plan for that employee? Or if you're a school or an educational institution, how do you plan for that student and that faculty to return? Once again, the word I want to remind people of, it's intentional. We can't just continue to do business as we've done it. And we have good numbers today because I think people are being intentional. But with each area that we open up, each sector that we move through, we have to be further intentional about our actions so that we can take the necessary steps. At this time, we want to be able to bring our children back into the educational systems and learning environments. I want to thank all of our mobile testing sites. We had a great week last week. Through their combined efforts, over 577 individuals were tested in those pop-ups. So Rockford Housing Authority, La Chiquita Foods, South Beloit High School, Winnebago County Housing Authority, and Winnebago High School and School District 323 that were our hosts for last week's pop-up sites. And again, we wanted to make sure that people know that you can come to any of these pop-up sites, drive-up sites, or our two more permanent locations at the College of Medicine Health Sciences campus on Parkview, as well as at Auburn High School. For a complete list of all of our testing sites over the next 2 weeks, you can go to wchd.org/COVID/get-tested. Lack of testing should not be a reason in our community that we have to then consider rolling back at any point in time. So again, thanks to everyone for their intentionality, because of those efforts today, we are only reporting 11 new cases for a total case count of 3,505. We have no new deaths to confirm. Our rolling 7-day positivity rate is just under 4% at 3.9%. And our overall positivity rate, those of us who follow us on a little more regular basis, is up from the high, close to 18%, is now at 7.3% overall. And the good news is 96% of our residents who have contracted COVID-19 are reported as recovered. We have no new locations of concern and no new communities of concern. So again, the reminder is continue to do the good work you've been doing. We are intentional about the actions we are taking. We want our children to be able to return to school in the next couple of weeks, our universities to be able to welcome our students into our region and area, but it requires all of us to be intentional. So with that, I would like to introduce Lisa Brown from Rockford Mass Transit, who will talk about all the intentional things they have done to make riding mass transit safe.
Thank you, Dr. Martell and Mayor McNamara, for having us here today. We certainly appreciate being able to spread the good word. Rockford Mass Transit is very pleased to announce that on Monday, August 3rd, we will be resuming our regular pre-COVID-19 route system. We would also like to inform our passengers that while service is starting on Monday, August 3rd, fare collection will not start again until Monday, August 10th. And it seems like it's been a very, very long time since RMTD ran regular service, so let me take just a minute to remind you what that looks like. Our standard weekday service consists of 19 routes serving Rockford, Loves Park, McChesney Park, and Belvedere between the hours of 5:15 a.m. and 6:15 p.m. At 6:15 p.m., the weekday service transitions to our night routes, which run from 6:15 p.m. until 11:15 p.m. in Rockford only. The late night shuttles will also run at 11:15 p.m. and will continue until midnight, transporting people who make final transfers to their final destination along the night routes. Saturday routes will also return to their pre-COVID-19 service levels starting at 6:15 a.m. and Sunday service remains unchanged. For more information, passengers should visit our website at rmtd.org, where all of our maps and timetables can be found under the Travel tab on our homepage. So we're very happy to be going back to our regular service, and we invite our passengers back on the vehicles. Well, when passengers do return to our regular service, we have a few things that they will notice that is a little bit different that we are asking that they be mindful of. First of all, on August 3rd, we will resume front door boarding again. Currently, we're doing rear door boarding. On August 3rd, we will resume front door boarding. Passengers will once again use the front doors and are being encouraged to exit via the rear doors now, so this will eliminate any congestion in the front of the vehicle. Next, in accordance with the guidance set forth from the Winnebago County Health Department, all seating areas on our vehicle will be available August 3rd, and all passengers will be required to be seated. We will not have any standing passengers at all at this time. The number of passengers, therefore, will then increase from the current 10 that we have now to 28, 29, or 32, depending on the vehicle size. And again, there will be no standing room only. However, we do not anticipate standing being an issue, as our ridership has dipped a little bit since our pre-COVID days, so we don't anticipate this being a problem. Passengers are still encouraged to spread out whenever possible on the vehicles. And as I said, once again, our fare collection is not going to start until August 10th. At that time, we have extended the time on our transfers from 60 minutes until 90 minutes, thus allowing passengers to board at the front of the bus, pick up their transfers, be seated, and exit at the rear doors, rather than getting their transfers as they exit. This, again, will eliminate congestion and hopefully help with social distancing. We hope to be introducing a mobile ticketing app very shortly in the near future. We don't have all the details worked out on that, but please look at our website and follow us on social media for announcements on that, because that will be coming very shortly. And that, we hope, will also eliminate hard surface contact for both our passengers and our operators. Effective August 3rd, there will also be other measures that we have introduced on our vehicles to keep our vehicles and our passengers and our operators all safe. We will be having 2 hand sanitizer stations on our fixed route vehicles and 1 on our paratransit vehicles. On our fixed route, we will have 1 at the front of the bus and 1 at the back of the bus. Passengers are encouraged to sanitize as they board our vehicles or use the sanitizers anytime they feel the need. We will also continue our aggressive cleaning measures, and that will include continuing to wipe down all of our vehicles that are in service during the midday hour. We will have our buses cleaned nightly with disinfectants, and we will also continue our systematic fogging that has taken place. And most importantly of all, passengers will still be required to wear their masks or other facial coverings that covers both their mouth and their nose at all times while on RMTD vehicles. Passengers not wearing facial coverings of some sort will not be allowed on the vehicle. And finally, we would like to extend our thanks to Dr. Martell and your wonderful staff, to Chairman Haney, who's not here, but we want to thank him, and Mayor McNamara. Your guidance and leadership and support over these last few months has been greatly appreciated by everyone at RMTD. If there are any other questions, I encourage you to check out our website at rmtd.org, call us at 815-961-9000, or see me after the press conference. Thank you.
Good afternoon. First, a sincere thank you to RMTD. Lisa and Michael Stubby have done a tremendous job, I think, in really helping set really wonderful examples from the very beginning of this pandemic. Obviously, cannot be easy for any mass transit authority to move through this global pandemic, but you've done it with grace and with compassion for your riders and thoughtfulness for employers as well. So thank you so much. Dr. Martell, again, thank you for the tremendous work that you continue to do. Especially impressed with the mobile sites. To hear 577, I believe, was the total number of individuals in these hard-hit areas that are getting tested now is really phenomenal, and I'm thrilled to hear that they're going to continue. Just want to say, as we look across the state, as we look across the country, we're seeing high increases in cases, but here in Winnebago County, we have been hovering around that 4% positivity rate, and Dr. Martell announced today that 3.9% positivity rate, so we don't want to miss that 0.1%. I think there are lessons that we can see of what we don't want to do when we look across the country, but we have our own lessons here of things that we do want to do. And I want to applaud several business leaders and organizations. Just this past Thursday, I was joined at a press conference with the Visitor and Convention Bureau, the Hospitality and Tourism Working Group, the Restaurant or the Hotel Association, and several small businesses to discuss the importance of making sure that everyone's wearing their face covering. The science is incredibly clear on wearing face coverings. Wearing a face covering or a mask when you're out in public or around people certainly helps the spread of this virus. When I wear a mask, it's to protect you, and when you wear a mask, it's to protect me. We need to continue to heed the advice that the health department has issued now for several months that wearing a face covering is critical. The health department has done a great job of educating and bringing awareness to individuals and businesses throughout our community. And this past Thursday, myself and nearly every mayor throughout Winnebago County has signed on to ensure that our local staffs at each one of our cities or villages will dedicate resources to ensure that we help with that education and awareness to all of the businesses to make sure that their employees and their patrons are wearing face coverings. As we know, it's one of the simplest, easiest things that we can do as a community collectively to benefit everyone, especially our positivity rate. So again, this is the time to be vigilant. Make sure that every single person is wearing a face covering. Make sure that you are washing your hands regularly. Make sure that if you have an event that can be taken outside, bring that event outside, and make sure that you're practicing that social distancing. The last thing I just want to mention, obviously there's a lot going on in our community right now and across the country. There's a number of crises that are going on, and typically in times of crisis, we have a number of things that are impacted, but domestic violence is certainly one of them. Just this past Monday, our Family Peace Center began seeing clients, and I want to give a specific message to those survivors that are out there that may be watching this. We're here to help you. We hear you and we believe you, and there are a number of resources in our community that are waiting to be along your side during that difficult and courageous journey. So I'd urge you, please, reach out for help. Call the Family Peace Center. You can call the Family Peace Center if you are in need of assistance by calling 779-348-7600. That's 779-348-7600. Thank you, and we'll take questions.
Mayor, you mentioned last week the mayors that got together for promising stricter enforcement.
Yeah.
Has there been any action that you're aware of to take any measures like that since that meeting?
So the question was, last week the mayors got together about stricter enforcement. Has there been any action taken? I'd rephrase that and say that the mayors got together to talk about stricter education, engagement, and awareness. And no, there has been no enforcement actions that I've been made aware of. I do know that multiple staffs were out educating folks and doing exactly what we said we would do. We certainly don't want to levy fines. That is absolutely not the reason for this. The reason for our initiative and all of us coming together as a county of elected leaders for our municipalities was to bring awareness. We have all dealt with so many different phone calls from either residents who have lost employment or small business owners who really fear that they may not be able to come back, and certainly a further closure would decimate them. And so we said, what can we do as elected leaders? And one thing that we could do is bring added awareness, added engagement and education to this very simple yet critical issue of wearing a face covering.
Dr. Martell, a couple questions for you. First of all, you talk about more permanent sites, in particular one at Auburn High School, but obviously school's about to start in the near future. I know we won't have as many people at Auburn High School as we're used to seeing, especially when it comes to cars, but is there any concern with how having students around that testing site might affect how permanent that is?
Sure. The question is, would the Auburn testing site remain as I'm going to call it a semi-permanent location? They are looking to relocate an area in that region, so that understanding that we do not want to impede, obviously we don't want to add another structure in that school environment that's already having to adopt and adapt.
Right, and then another question, you were talking about really good numbers. Just want to clarify, are those 11 new cases since Friday or just today's?
Today, that's the daily count.
And then you mentioned positivity rate. Obviously, across the country, 4% isn't anything to scoff at in particular, but I believe, if I'm not mistaken, midway through last week, we were looking more at 2.5%, maybe 2.7%. Is that raised up to about 4%? Any cause for concern for you?
Well, we continue to monitor. The question is, am I concerning about increasing positivity rates? Well, we've talked from the get-go, yes, we are concerned about increasing positivity rates. And I know there was a concern, would more testing increasing positivity rates? And the answer, no. Because again, we've kind of addressed this in the past. We continue to monitor that in relation to other regions and areas. Remember, that's a 7-day rolling average. So there are some days, and it's based on when test results come in. So oftentimes, we may get a surge of test results that get released out of the electronic lab system. So that's why that rolling average becomes the more critical piece to look at. But when you look at when we were close to, in our peak, almost 1 out of 5 having an infection, and now we're really, really down below that number at 4%. We really begin that process of, we continue to monitor it. It requires every single one of us to be intentional about our actions that we can take to prevent the spread.
You mentioned, I'm sorry, I missed this, the percentage that have recovered.
96% is the calculated recovery rate.
When we talk about recovery rate, does that mean no more symptoms, no health issues lingering?
No, we've talked, again, this is a timeline recovery rate, and again, we know that there are individuals that are, obviously does not include individuals who are deceased, but it includes those individuals who have really are out there beyond that 28-day mark. And again, taking a look at that, there are people that are going to have long lingering symptoms. We've heard in the literature about some of that, some people call about, the phase or haze that they get with it. Some people have some neurological concerns. Other people may have lingering respiratory concerns. But again, this is related to the fact that these individuals, after meeting their quarantine and isolation period, would be allowed to return into the work environment because they are no longer what we call actively transmitting the disease.
Lisa? So you mentioned there was a limit placed on buses of 10. Now 28, 29, 32. Is that the number of seats that are on those buses, or is that some sort of capacity limit, or is that just the number of seats that are there?
The question is about the number of seats on the vehicles. So the 10 that we had, or currently have until August 3rd, is the number that we allow with the social distancing that we have in place. On August 3rd, depending on the vehicle type, we have 3 different types of vehicles in our fleet. Depending on the vehicle type, the seated capacity without wheelchairs would be 28, 29, or 32. So depending if you have one of the newer vehicles, the seated capacity, everybody in a seat, would be 32. If we have a wheelchair, we lose 2. If we have another wheelchair, we lose another 2. But seated capacity, everyone in a seat, is 32.
So you're saying you'll allow the buses to be completely full?
Yes, seated, yes. Full capacity is about 44. That's including standing room only. So you can see we're about half of the capacity, full capacity with standing room only. Did I answer that correctly for you? That you understood?
Are you requiring drivers to be tested?
We're not requiring our drivers to be tested. We are requiring our drivers to wear facial coverings and protective equipment. And we have also put on all of our vehicles a plexiglass shield separating the driver area from the fare box and where the passengers will now be boarding.
Is there any type of that kind of separation, especially when it comes to potentially having whole seats taken up in a single bus? I think some people might think that is pretty close contact, regardless of how long that is. Is there any sort of separation on individual seats then?
Well, what we are asking is that first of all, we do not feel that there will be full capacity at many times. Most times there will not be full capacity on our vehicles, simply because our ridership has dropped off, and it's very rare that we have standing room on most of our routes anyway. So we feel very comfortable with seated capacity being the goal. Secondly, a lot of people are families traveling together. So we feel that even under the current social distancing, families were allowed to sit together. So we feel we'll see a lot of that happening as well. If there are seats available as we go along on our routes, we're encouraging passengers to not clump up, not to sit all together, spread out amongst the vehicles. We also feel that with our stopping, especially this time of year, with opening up the doors and leaving the doors open for a little bit, we'll be getting good airflow through our vehicles. We can also have our windows and our upper hatches open to encourage airflow. So we feel that these numbers will be very safe.
Mayor, I do have a question for you. It is not COVID-19 related, but over the weekend, there was a group of protesters who did show up at your house. I'm wondering if you have any comments about what happened. They had previously said that they did not want to have a dialogue. Do you feel that they do now, or any comments on that?
So the question was, over the past weekend, we had some protesters at my home. And what was the second part of that?
Previously, they had said they didn't want dialogue, but showing up at your home, do you believe they do now with you? Or?
So the second part of that question is, previously this group has stated that they did not want to have dialogue. Do I feel as though they do now? First and foremost, I certainly respect their right to protest. I do find it disappointing that they've not engaged in the productive dialogue requests that we've had time and time again over the last 60 days. I just want to also make clear, we have a number of really amazing organizations that are working to push Rockford forward and make it a better place for everyone who calls it home. And I am 100% committed to work with any one of those groups who want to have productive dialogue to move our city forward. You know, really one of the reasons I ran for office certainly was not foreseeing a lot of the struggles that we were facing, but I also was aware of many of the struggles that we were facing, and I want to make Rockford a good place for every single person who is born and raised here to live and to take pride in. And obviously, we have a lot of work to get to that point, and I am eager to do that work with every citizen who would like to do so.
Do you think there was any, because if I'm not mistaken, when you did go out and address the protesters who were outside your home, do you think there's any closer bridge to understanding between you and this group of protesters that is that have said before they aren't really interested in a dialogue with the city?
So the question is, do I feel like there's if we're any closer to having that bridge towards dialogue? Well, I've been 50% of the way there the entire time, so my belief of having dialogue is still there. I don't know the answer for this group. Incident lasted, 20, 30 minutes, whatever it was, but our interaction was limited. I'm not going to have a dialogue out in front of my home.
But you're inviting them, right? I mean, you're open to meeting.
The question was, am I open to meeting? Absolutely. I'm open to any productive meeting to move our community forward. Absolutely.
And you're saying they have declined that invitation, or what?
Numerous times. Any other questions? All right. Thank you so much.